You have to seek medical attention. That's number one. Once you recognize the symptoms, most of my patients, the spouse or some family member notices that there's a problem, and they convince that person to come forward. Next is to have an examination by a physician, and what we usually do is ask these questions. How sleepy are you? Are you sleepy driving, or is a passenger in the car after lunch? And do you feel sleepy at stop signs? Once you do that, then you send that person for evaluation. So either you can do a home sleep apnea test, which we do quite often, and we also do in-lab sleep studies for high-risk patients with comorbid conditions like high blood pressure, heart disease, things like that. Some people qualify for the home sleep apnea test, where they take a kit home, they wear it at night, and then they bring it back, and then we score it. So that's the easy way of doing it at home. In the in-lab study, it's a pretty involved study. They're hooked up, we monitor their EEGs, their breathing pattern, their oxygen level, heart rate, etc. And at the end of the test, sleep technologist basically scores the study, and we come up with the number of times that somebody stops breathing or has shallow breathing, and then we come up with scoring, either mild, moderate, severe sleep apnea. We've had the sleep lab in this community for the last 22 years, and we do, I think, a superb job. Staff does a superb job. Patients like coming to the sleep lab.